Good morning, everyone, and welcome to our webinar. This is Jordan, the marketing coordinator here at AIM. Today's webinar will be recorded and then later posted on our website. This does mean that all attendees will be automatically muted so that we get a quality recording. If you have any questions, go ahead and type them into the chat box and we'll try to answer them throughout the presentation. But if we're unable to get to all the questions, we'll have a member of our marketing team reach out to you individually to make sure you get that answered. Before we get started, we'd like to invite you to join us for next week's webinar on Tuesday, September 24th at 9 a.m. Pacific Time. Lead internal wholesaler Don Erickson will lead you in a crucial webinar on long-term care planning where you'll learn how to safeguard your clients' independence, assets, and family with effective strategies tailored to their unique needs. And with that, I'll hand it over to Nisha so that we can go ahead and get started. Take it away, Nisha.
Thank you, Jordan. Good morning, everyone, and thank you for taking out the time to spend with me. Today, I'm going to talk about why extended care is so crucial. Okay. So the agenda is LTC, problem or not, it's still needed, underwriting, long-term care and extended care costs, benefits, home care, facility care, not offered in every state, trends, conversation starters, contracting, and of course, thanking you for spending a little bit of time with me. Okay, so long-term care, problem or not, it is still needed today. It's not that traditional LTC is the problem. It's still needed even more today than before. The cost of getting the policy and qualifying for it doesn't change the fact that there's still a need for the care. It's the consumer's health that pays for the policy and their money that buys it. It's also shouldn't discourage you as the agent to turn away from selling the product that is not only great sale, but it's profitable. Most buyers of long-term care insurance are between the ages of 50 and 69. The sweet spot really is 55 and 65 for applying for long-term care insurance. In fact, 78% are likely to apply and purchase an LTC policy. Most people 40 and under are 6% likely to buy a long-term care coverage. So there's an opportunity to have conversations with this demographic of people. Most buyers of individual LTC insurance select an initial policy with a maximum monthly benefit between $3,000 and $6,000. Adding in inflation as a growth factor, it'll increase the value of their benefit amount each year. So it's not only it isn't a problem for those individuals. It's a problem for those individuals who don't qualify or cannot afford to purchase the policy. So then it leads to the disclaimer, it's not for everyone, but it is needed for those who can qualify and can afford this policy. Let's talk about underwriting to be accepted or not. Again, their money pays for long-term care insurance, but it's their health that really buys it. The cost of waiting to buy either long-term care or even short-term extended care insurance, the premiums increase as the consumer gets older. As I stated before, most buyers of long-term care are those who are in the sweet spot age of 50 to 69. And to even further your conversation to the younger generation, remember 6% of people aged 40 and under are likely to buy a policy. So that's more of a healthier, possibly more qualified generation of people that can not only get past underwriting, but also can afford to purchase a policy. The underwriting process for long-term care, it has become more detailed in what they will accept or won't accept to be approved for coverage. For extended care, short-term care, there are policies that have as little as 1 to 2 health questions, which can be ideal for people with existing health problems. Other carrier applications have around 7 to 10 health questions that if they can answer no to all, they're 95% likely to get through the underwriting process. Most insurers decline nearly half of those who apply after the age of 70. That's about 47.2%, while people aged 40 to 49 are 12.4% likely to be declined. So, again, a good demographic of people to talk to about long term care and short term care are people aged 40 to 50 or even younger, as they are 6% more likely to buy a policy and roughly 87% likely to get through underwriting. A glimpse into the cost of long term care. So, long term care is estimated per month about to $200 in premium, or 5 to 7 grand per year for a couple. The premiums the premiums are higher because the coverage is more comprehensive and the benefit period for an LTC can last up to the client's lifetime. While the extended care insurance policies are usually limited to 1 year, currently most consumers select some form of inflation growth so their insurance benefits grow in value as they get older. It is important to carefully get comparisons and understand the different ways insurers can calculate growth. Adding in a buy-up option gives the client the flexibility to adjust their inflation protection benefit as their needs change over time. So for extended care costs, the care of choice that I've used for this example is GTL. Just to put out a little disclaimer, extended care, short-term care, it can be an option for those who are young and old and those who have existing health issues. Individuals or couples can get extended care coverage up to the age of 89, depending on the carrier. This slide shows you the affordability of extended care. For those who don't qualify for long term care, extended care is often a good option for your clients who may need immediate funds for recovery, care after an accident, illness, or surgery. You don't have to refer out of your practice. You can keep all business within. The benefits are paid to the client directly, with premium costs estimated monthly about $50 to $200. And as you see for this couple, age 65, their premium estimate is about $169.73. So depending on the policy and age of in health, the premium can be between $50 to $200. Excuse me. The typical short-term care policy coverage is up to a year or less. For many, this is very appropriate and an affordable amount of coverage. Most extended care policies, they have a 0-day deductible elimination period option and a full year of business or benefits, which mean the policy pays on the very first day that your client qualifies for the business, the benefits. Oh, it's only Tuesday. Okay. So let's talk about those benefits. Extended care, short term care provides services that people usually need when they are unable to take care of their ADLs on their own, including services involving staying in an assisted living facility or a skilled nursing home, services offered by home health care aides, or even certain prescription medicines. Additional recovery time at home or even additional long-term care is often necessary after being released from a hospital. And extended care could be useful in addressing those needs. For example, in, intensive rehabilitation, access to specialized therapies and medical services designed to accelerate your recovery. Close medical supervision, continuous monitoring by healthcare professionals to manage and address any complications promptly. Transitional support helps bridge the gap between discharge and home, ensuring a smooth transition and reducing the risk of readmission. There are just over 1.3 million people in the United States nursing homes. Far more people these days need and receive care in their own home. Options for in home care providers include homemaking service providers, which can help older people with activities of daily living and household tasks like cleaning, cooking, running errands. Home health aides are another option since they are trained to provide more extensive care while also serving as companions. At times, individuals and families may choose skilled in home care. The more intense the medical care required, the more expensive it can be. For example, a typical homemaker companion service costs about $195 per day. Home health aides, you're looking at about 213, and for a registered nurse who works a 10-hour day, that's a very long day, um, they're looking at $400. Some of these services are not needed all day or even daily. This is just to give you an idea when you're talking with your clients about the increase in cost. An individual or couple that has extended care, they have up to $450 of daily home health care available. And if it's a family member that's assisting them, that family member has access to $3,500 in caregiver benefit available. Service days, they have up to 360 service days or 52 weeks. Rates have climbed considerably in the recent years, a trend that looks to accelerate over the next several years. In fact, if projections hold, the monthly cost of a semi-private room in a nursing home will be well over 10 grand by 2030. My heart drops for those of us who are in our young 40s. For some private rooms, ex- or for private rooms, expected annual costs already have passed the six-figure mark. In every state, the cost of both types of rooms in nursing homes rose between 2015 and 2021. From for some states, the increase have been very dramatic. For example, the state of Minnesota, which already had a median cost higher than the national average. They also saw the largest increase in semi private and private rooms. Here in the state of Washington, there was a 3% increase versus Minnesota's 10% increase. Excuse me. Some clients may choose to stay in an assisted living community as it's more affordable. The costs continue there to rise as well. The estimated median cost is about $181 per day, which is about $5,511 per month, or 66,126 annually, depending on the state. While this shows an increase over the past few years, assisted living is still an affordable choice versus a semi private or private room in a nursing home. Daily rates for skilled nursing care vary based on where your client lives and the chosen provider. The cost is also higher if they choose a private room versus a semi private room. In 2024, the median national cost for a private nursing room is $330 per day. Remember, with extended care, couples and individuals can get up to $450 per day. And a semi-private room is $294. Most people are there only temporarily, others may stay longer. So, in helping your clients and their families understand the potential out-of-pocket costs if they don't have a solution in place. The expenses may seem steep at first glance, but helping them understand what is all included in the cost: room and board, nursing services, everything else that the facility offers. Also, this isn't necessarily an out of pocket cost. They may be able to use insurance and state programs to help pay for the cost, but extended care is an option that comes in to help as well. The benefits are paid directly to the client, so they don't have to wait for state approval or other insurance to decide if that coverage is approved or not. Location also has influence on the cost of skilled care services. As when you get older, a lot of people move to a different state or city to access more affordable care. While skilled nursing care is the most expensive, some states have more affordable options than others. For example, here in the state of Washington, a semi private room is $12,532, or a private room is $14,099. Praise Jesus. Whereas in Alaska, the semi private room is 19,267 and a private room is 35,622. A few states with more affordable care: Texas, Missouri, Oklahoma, and Louisiana. That's just to name a few that have affordable care. If you're an agent in those states, it would be good to sit down with your clients, if you haven't already, and discuss with them a solution to help cover the cost for skilled nursing care. Regardless of the cost of nursing care, there are many ways families can make the necessary care more affordable, and that's with extended care insurance. Now, please take note of my adorable pretty cat there. This product is not available in every state. It should be in every state as it will help so many people. Unfortunately, it is not. It is available in the select states that you see here on the screen. And if you are licensed in multiple states, this is not only a benefit for you, but for your clients as well. This is also due to select carriers as well. The states listed above is for the carrier GTL. So if you're contracted with GTL, here is the list of states that are available. Please get with your marketer if you want to learn more about the other available carriers that offer extended care, short term care. So, some trends in conversation starters. So, trends. Home health care is expected to grow as the senior population increases. This includes franchising, remote patient monitoring, companionship services, and technology innovation. Mental health services, demand for memory care programs is expected to increase as more adults are diagnosed with Alzheimer's and other forms of dementia. Preventative health care. Primary care physicians and other frontline healthcare providers are expected to screen for mental health issues that may impact physical ailments. The occupancy levels in senior living are expected to reach pre COVID levels in 2024 alone. Assisted living and memory care are expected to see the largest occupancy gains. Home-based services is expected to grow as baby boomers continue to retire and prefer to receive care at home. Inpatient rehabilitation is expected to see substantial growth as well. And then AI, artificial intelligence, our soon to be best friend, is expected to play a significant role in addressing staffing shortages in the senior living industry. AI powered tools can help identify suitable candidates and guide new hires through the onboarding process and reduce the HR workload. Hmm, exciting. Now for conversation starters. These will help position you as a trusted advisor with your clients in the extended care, short term care space. Here's some tips to just get you started if you are a newly established agent. Why it matters. Have you asked, talking with your clients, have they thought about how them or their loved ones would handle the long term, short term care needs? Extended care planning helps to ensure that they are financially prepared for those possibilities. Take note of the rising cost of care. Remember, in Alaska, it's 19,000 just for a private room. The cost of extended care, whether at home or in a facility, it continues to rise. Planning with the right coverage can help protect your savings and your assets, protecting your loved ones. Extended care planning, it isn't just about you, it's also about ensuring your family isn't burdened with the emotional and financial strain of providing care. Really helping the client understand that they need to have the conversation with their children, with their cousins, their sisters, brothers, and not just expect them to step into place, because not everyone in the family is financially ready to take that on. So, really sitting down with that client and helping them to understand, did you actually speak to a family member? If so, how did that conversation go? Or even just being there with them and having that conversation as well. Preserving their financial independence. Having extended care coverage in place means they can maintain their independence and have more control over how and where you receive care. Just imagine what state care looks like right now and imagine it 10 years from now. I'll leave that to the imagination. Customized solutions. We can tailor an extended care plan to fit your specific needs and budget, ensuring you're protected without overextending your resources. So, really sitting down and doing a needs analysis with that client, and then again, whether it's just them or the kids, whatever family member that they are assuming would be the person to step into place for that, making sure that they have the understanding and being able to tailor that policy around their financial needs. Whoop, whoop. Oh my gosh. Now it's time to say goodbye. Contracting. Let's get it done. It's simple. Some carriers respond same day, while others take about 7 to 10 business days. It does help to get started today with the contracting. We definitely want to beat the blackout period. It's easy, it's conveniently located in one portal. So get with us, one of your marketers today, and let's get started. Let's take the next step so you are prepared and ready to have a fluent conversation with your client. And like always, I love that we get to spend about 15 to 20 minutes together. I am Kanisha, aka Nisha. You can reach me at the numbers listed below. You can email me. Also, why not follow us on social media because it's another form of communication with this younger generation nowadays. But there's all our handles and all the platforms that you can find us on. Again, I am Nisha, and I'm glad that you took the time to hang with me today. I hope you have a good rest of your week. Bye.